Hello and welcome back to the show, everyone. I'm your host, Levi with Mailbox Money, and today's guest is Muhammad Atif, the CTO and president of PureLogix, a global software development company that helps startups, growing businesses, and enterprise organizations build custom software, web and mobile applications, and AI-powered technology solutions. Since co-founding PureLogix back in 2006, Atif has helped bring more than 1,200 ideas to life while leading projects for companies ranging from startups to global brands like Intel, Samsung, Honda, DHL, Pearson, and Live Nation. Atif, welcome to the show. We're excited to have you.
Thank you, Levi. Really excited to be here.
Absolutely, sir. We better give the people a little bit of background. Where were you calling out of today?
Yeah, I'm here in New York City right now, working from our headquarters in Manhattan.
So, if you wouldn't mind, could you kind of take us back to the beginning of your journey? What kind of sparked your interest in software and technology, and what eventually led to you co-founding PureLogix?
Yeah, so I have my major studies in computer sciences, and after that, I started working as a software engineer at one of a leading software house back in my home country. And during that, it was very fascinating to see how the problem is being solved, and I have always been into problem solving, and that has been the biggest inspiration for me, and how the technology can allow you to turn your idea or challenges into something that really matters or that really solve the problem. And I also learned that I enjoy the process of building, testing, learning, and improving. And Levi, the most rewarding part is seeing the tech solving a real business or human problem. So we worked over there for about a year, and I have one of my senior colleague over there. So we both decided that we should launch our own venture. So back in 2006, we started this company with three co-founders, me and two other, and they were also my senior in my college as well. So we named it PureLogix, and Levi, the idea behind was that to help the entrepreneurs who are looking to take their idea to the market, or SMEs or SMBs who are looking for a right engineering partner to grow their business to the next level. So that was the idea behind. So we started with like three people back in 2006. We started growing slowly, and right now we have a team of around 400 plus people, and we are a global firm with
Wow.
offices across in New York, California, London, UAE, and we also have an office in East Asia, Lahore, Pakistan as well. Yeah. So over the time, we have been working to different industries, but we have specialized in healthcare a lot. We have been doing a lot of work in the healthcare industry. On top of that, we have been working like in tech, layer, fashion, and e-commerce industry as well. We are ISO certified, ISO 9001 2015 certified. We are also CMM level 2 please, which means that we have pretty well-defined processes for project onboarding, execution, closing, and after support. Right now, we are pursuing ISO 27001, which is a standard for delivering and building secure applications, because we are into healthcare, and security is one of the main thing we take it very seriously.
Yeah, I can only
Uh,
imagine all the layers that you have to go through in the healthcare world to
yeah.
stay secure. I'm sure that's a great challenge for a lot of companies.
And that is where we are right now. We are also partner with Amazon. We have AWS certified engineers in our team. Right now, we are working with a lot of our customers, including startup, SMEs, SMBs, and few enterprises to uh, bring AI automation layer on top of that. We try to study their current use cases. We go through their data sets, and then we try to automate as much as, and the end goal is to increase the productivity. The problem or the project which is taking maybe 1 week before, it can be done in like maybe few hours or one day. And that is efficiency that we are bringing by implementing these workflow automations and AI agentic and AI engineering solutions. So yeah.
Specifically in the kind of healthcare space, what is some of the big impacts that you're seeing with AI and helping reduce those timelines?
Yeah, so Levi, if I talk about healthcare, I mean, healthcare, directly impacts the people's life. It's associated with the human life. In many healthcare system, are still fragmented or way outdated. And common challenges that we face here today is disconnected records, manual billing, uh, system that cannot communicate with each other. And there is a major gap between what tech can do and what is actually being used. So here at PureLogix, like we have developed a healthcare practice over the time that closes these gaps. And during past, like if I take example, 10 years, we have built 100 plus healthcare like specialists within our team who are trained with that mind at how to build secure applications. We have trained them through HIPAA developer guidelines and all that stuff that is required to work on any HIPAA compliance application. And with the help of that team, we have delivered 150 plus healthcare applications, uh, following all the like compliances of HIPAA, HL7, FIRE, and making sure they are high tech compliant platforms.
The companies and that you're helping with, where are they kind of starting from? Are they do they have a platform already that you guys are helping refine, or is there examples also that you guys are building out that platform for them?
Yeah, there are both kind of customers. There are startups who come up with an idea, and we try to solve their problem from scratch. Like I remember that one of the company that came back to us in 2013, they were trying to solve the communication gap between the patient and the provider. So the idea behind was that the doctor or the provider can see all the medical history of the patient, and they can advise a customized treatment plan for each patient. And then patient has a luxury that they can download a mobile application. You know, in 2013, mobile application was one of the biggest thing. So they can download the mobile application, they can see their treatment plan, and they can keep a track on day-to-day basis by adding activities, how well they are making progress on that treatment plan. And the good thing was that if the patient is stuck at any time, they can communicate directly with the provider through that application. So that was very first idea. I mean, the customer was coming with a fresh idea, and we tried to implement that. And then during this whole journey, we had Levi customers who have already built out their systems, Lexi system, or some kind of their technology they are already using, like EMR, EHR. So we try to build some like automation layer or try to solve interoperability issues. As I mentioned, that most of these systems are disconnected, and having a proper communication between them is a real problem. So we have
Yeah,
worked with those
absolutely.
kind of customers at the same time as well. Like I remember uh, back in 2024, recently, like we were working with a Florida-based hospitals who have a chain of hospital across in East Coast. So they were facing visibility issues for their C-level executives. So we didn't change their core EMR or EHR, whatever they were using for day-to-day practice. We just tried to implement dashboards on top of that using Power BI and some data analytics and putting some ETL and real-time data inputs from the existing Lexi system to show the correct picture to the C-level so they can make the decision. So
Gotcha.
we work like with those customers as well. Yeah.
What would you say? Did you see a huge jump in the need and demand for this after when the pandemic came? Obviously, um, being able to get the full picture of a patient and a provider knowing the full picture and being able to communicate became way bigger of a deal when they weren't able to see them face to face. Did you see a huge jump in demand during that period of time?
Yes, I think that was especially for telemedicine and online care applications. That was the time because people were not uh, visiting the physical facilities due to all the restrictions at that time. And we saw a lot of ideas came around that time. So I remember that there was a company who were working on women's health. So they came to us and they were building pregnancy strips, right? So they told me a story that okay, we want you to be digitized. We want to be part of AI ML layer that is coming. That was their like biggest idea. So me with my team of engineering and business analysts, we had a meeting with their biologist. We had a meeting with their operations team. So we come up with an idea that, okay, let's build an application which can take the pregnancy strips image that we can decode using computer vision and some other algorithm at that time back in 2020 and 2019. And then with the help of their biologists, we built some algorithms, formulas, which can generate different uh, like uh, predictions or charts for women to take care of their health in a better way,
Hmm.
especially the fertility and all that. So that was one of the idea. And then another company I know, they were solving diabetic patients problem. So uh, again, they came to us and they were saying, okay, we want you to have providers helping the diabetic patients, especially the patients who can't feel the temperature on their feet. So we build again architecture and overall ecosystem for them where a provider can take the picture of the patient's feet using the thermal device, and then using that it can help it can generate some readings for the provider and doctor to have more visibility and then prescribe accordingly. So a lot of these kind of ideas that we that were about diagnostic prediction, helping the patient to have better care through digitization, uh, we worked on. And then another wave that came with the AI and ML right now. I mean, we are seeing a lot of people trying to solve a lot of problems. So I was talking to one of the founders. So they are working on helping law and like the police and all that departments through the
Uh-huh.
technology, so they can detect early detect the people who are drunk instead of having a physical device with a mobile application. We're also working on some ideas to provide care to third world countries who can't afford, so they can detect different diseases through retina image of the eye. So these kind of things that I'm really excited about, that we are working in this space.
Really amazing. Kind
Yeah,
of along those lines, helping out people, often the fear with AI is people are worried about it replacing jobs, right?
yeah,
How do you see AI changing the roles of these people using them and more assisting them rather than replacing them?
yeah. So I think in the specifically, if I talk about Levi healthcare, AI can't replace the human. We need to have human in the loop. So AI can assist in diagnosis. It can assist in disease prediction and early risk detection. AI can also help us in administrative automation. Like a lot of when you walk to any clinic, you have to go through a lot of like data entry. You always see the provider and the clinical staff is just doing the data entry for you. So that can be solved by AI. We can reduce the documentation burden for all the staff members. We can have more personalized treatment based on your previous medical history, allergies, and all that data that can help better prescribe personalized treatment for the patients. It can help in remote patient monitoring, instead of someone who can't access care on site, they can have the remote treatment options. It can also help to connect with different wearable devices, IoT devices, and we all see that they are also becoming part of our day-to-day life. I mean, everyone have either Aura Ring or some wearable watches which can read different health parameters, and AI can read those, and if they find any of anomaly, it can raise the alert with all the right stakeholders, whether it's family members or their family doctor or PCP or whatever it is. uh, it can also help to identify healthcare organization problems earlier. So these are the areas where AI can really help and expedite, but it can't replace human. The end goal should be the patient is getting care, and they are getting in an economical way and getting on the time. It's also helping the provider and clinical staff to more focus on personalized treatment and personalized care instead of worrying about compliances, documentation, and data entry.
I've got more from the perspective of kind of the healthcare leaders. If you're talking to an hospital executive or healthcare organization that's just starting to begin on the AI journey, where would you suggest that they start?
Yeah, so I think first of all, they need to understand that the compliance, the data governance part, that come first of all. And organizations, they need to understand uh, what patient data is being used for, where the data is stored, who can access it, how the data flow through AI system. And then there should be proper like audit log and traceability matrices. Security and compliance must be part of the architecture, whatever technology or AI they are adopting from the day one. Uh, and compliance should never be treated as something added just before the launch. It should be the part of the process. Uh, and again, if they are Levy going for any AI implementation, they need to see the quality of their data and they need to start with the simple process, which can be automated and then slowly updating the other. And the end goal again should be uh, to expedite the patient care and reducing the burden of the clinical staff and provider on administrative work and focusing on the actual patient health problem and giving them the right treatment. Yeah.
Kind of since you've been worked with startups all the way to large enterprises, what would you say separates organizations that are successfully implementing technology and from those that are struggling with it?
Yeah. So I think the companies who have proper understanding, like what are their needs, and who identify what areas they can improve on the time, and then they have a complete roadmap, and then they have clear like plan for measuring the success on those. They are way ahead instead of and then taking your all the staff members, like how ready is your staff members to adopt that technology and giving them the confidence that it's not going to replace them versus giving them the confidence that it's going to expedite their job and they can focus on the real problem instead of administrative work and manual data entry and all that stuff. So these things like proper planning, understanding your core areas, having proper compliances and data governance in place, taking your team into confidence. Those are the companies. And then what is your overall data storage and usage policy, and making sure that you have the right data sets available, because what AI is going to tell us or what the system is going to tell us is how good is your data.
For
And if the
sure.
data is not right, I mean, it can't solve the right problem. So these are few attributes that distinguish a successful company versus the other one. Yeah.
Tiff, if people are trying to find you and your company, PureLogix, where would you send them to do so?
Yeah. So uh, they can visit purelogix.com, PURELOGICS.com. You can also search me on LinkedIn, Muhammad Atif. I'm also available on X, Twitter as well. Feel free to reach out me through LinkedIn or visit our website, and you can fill out the form or contact us.
When people look back on your career years from now, what do you hope they'll say about the impact you've made through technology and innovation?
Yeah, so the thing that I mentioned, Levi, at the start, it's the same that we are trying to solve the real problems, making sure that it's adding the productivity. If it's a business problem, if it's a healthcare problem, it's adding real impact. It's making the life easier, and also it's not something that is adding more burden or more paperwork or more like data entry kind of stuff. So that is the one thing. And the second thing is the innovation. The thing that I'm really excited at working in the specific in the healthcare, not only we have built these like EMR, EHR, but we had the luxury to work with these really exciting startups who come up with these innovative ideas to solve the problem. And we really feel excited when we see that it's solving the problem and the patients are getting care on time with the right innovation and right tech.
Amazing, that Tiff. It's so refreshing to hear that even on the backside of things with the technology and everything, really at the end of the day, even for a company like yours, it comes down to the patient. getting what they need. So again, that's amazing to hear, sir.
Well, yeah, thank you, Levi, and it was really nice to talk about this topic.
Yeah, we appreciate your time and sharing your insights with all of us. Thank you again. And thank you all for listening. We'll see you guys on the next one.